We're now just going to move straight into the second panel for this afternoon's conversation, which is about the how. And I think Janine's given us a good overview around some of the key elements of that transition. I'm also now going to ask for Professor Juanita Sherwood, who is the Acting Pro-Vice-Chancellor of Indigenous Strategy and Resources at the University of Sydney, to join us on stage as well. She is currently the Acting Deputy Vice-Chancellor at the Sydney University, and she has come to this role having been the Academic Director at the National Centre for Cultural Competence at the University of Sydney, with a mandate to engage, innovate and lead in cultural competence. So can you please join me now in welcoming Juanita Sherwood. We're also calling Dr. Kelvin Kong, who is our very first and most eminent ear, nose and throat surgeon from the Hunter New England Local Health District. He is qualified as the first Aboriginal Fellow of the Royal Australasian College of Surgeons, specialising in head neck surgery, and he also hails from the Wummurai people of Port Stephens, north of the state. So can you please join me now in welcoming Kelvin. We've now got a wonderful group of CEOs, Mr. Darryl Wright from the Tharawal Aboriginal Medical Service, who for the past 12 years has been the Chief Executive Officer, where he has used his extensive management skills to build the Aboriginal Corporation into a thriving and effective community asset. He hails also from the Wummurai people from Port Stephens, north of Newcastle. Thank you. Oh, my apologies here, there's no here, 1M. Yagar. There's not so many more things I can get wrong today, people. I can't believe it. Bless. So can you please join me now in welcoming Darryl. Also, we have Ms. Amanda Larkins, who is the CEO from South West Sydney Local Health District, and she has, goodness me, leads more than 12,000 staff at the South Western Sydney Local Health District as the Chief Executive. As part of her role, Amanda provides strategic leadership and sound governance to achieve safe, equitable and quality health care for the booming and diverse population of South Western Sydney. So thank you so much, Amanda. And finally, Mr. Nathan Jones, who is the Director of Aboriginal Health at South West Sydney Local Health District, and he has been the Director for Aboriginal Health at South Western Sydney for the last 6 years, and for the last 18 years worked in a variety of roles within both state and Commonwealth agencies in Aboriginal health. And here is our wonderful panel. But we're going to start with Juanita first of all, giving our wonderful sister's voice a bit of a rest for a moment. And Juanita, your focus really has been on cultural competency, and particularly working with Cats and AM on birthing on country and care for country principles and bringing those things into play in Aboriginal health circumstance. How would you use cultural competency to really change and transform the agendas that we've got in this reset?
Okay. I guess, how would I do that? I think critically, having, I guess, worked in Aboriginal health for 30-something years, cultural competence and we have the term cultural competence because that's an established health identity. But in fact, it's cultural safety, and being a member of Cats and M. I'm definitely, and I was there when Era Habiti Ramsden came to our conference and spoke to us around cultural safety, and we learned a great deal, and we've been rolling it, I think, across this country. Am I making too much static? Okay. Sorry, guys. Okay. So basically, I think cultural safety has been an agenda that we've known and grown. But unfortunately, it's something that we do have, and we have definitely promoted, but it hasn't been heard well within the health system. And I guess what I've built my knowledge in the cultural competence agenda across the world. And Georgetown, Washington, have been running cultural competence agendas for the last 20 years in health. And it came up with a really good definition of what cultural competence was. And it was about making sure that we change the system, ideally. It's about recognising that the system is the space and place that continues to generate what is not good healthcare provision. And having been a health professional for a very long time, I witnessed that as a health professional, and I think that's really important, that we send our people, not just our patients, into health systems that aren't sensitive and friendly, but we send our health professionals in there. And having to deal with, and I worked in mainstream health services for quite a while, not being culturally safe and competent and putting our own health workers down has really been a really important perspective that I think is ignored often. And I think cultural competence has been a great avenue to say, hey, we need to change it. Racism is a determinant of Aboriginal health, and we really need to acknowledge that.
Thank you so much. One of the things that you were talking about recently was around the Health Justice Committee and perhaps using that as a vehicle to help reset the agenda. Could you just talk to us a little bit about...
Okay. The Health Justice Committee was set up with a number of people that are around here today, and I think it's a great committee. It's acknowledging that health is a basic right that everybody should be able to have access to. And I think a number of the cases you brought up just in your talk were clear examples of where people did not get treated as humans. They were dehumanised and they were left to die in places that were pretty horrendous. I lived in the Territory for a number of years, and I was there when we had a patient who was left similarly to the pregnant, or to the woman who just had her baby, at an airstrip in the Northern Territory, and he died because he was left there for 24 hours because nobody bothered to ring the health clinic to let them know that they were dropping him off. That would not happen to a non-Indigenous person in the Northern Territory. I know that. And that's why we're working on this Justice Committee, because we know that we get treated differently. We know that there is not equitable care out there, and we know that we have to press every button that we can to actually... I mean, it's a story that, you know, for 30-something years I've been talking about, and we're still dealing with that same story. So it's great to have an opportunity to be with my peers in this space who all agree that we need to have a change, reset the racism button.
One of the things I was interested in Janine's talk, and I know that both of you do this work, but it's around bringing culture as the protective factor into our work and practice and healthcare delivery systems. And some of the ways that you're looking at doing that is that focus on the first 1,000 days and re-engaging in birthing practices and giving people empathy and power and control during that period of time. Is that something that you think will actually help to reset the agendas by bringing culture back in as the protective factor for us all?
Look, I think that's one step. I probably would take... You know, I'd go further to say we were actually trying to decolonise the whole process. Birthing has become a medical space and place, which it never was. You know, we really have to recognise, you know, not only have we over-medicalised birthing in this country, but, you know, we burnt midwives, you know, for hundreds and hundreds of years because the medical profession couldn't cope with, you know, women having power in this birthing space. That's a story that we have to remember. That's a history we have to remember and recall. And we believe that having an opportunity to birth in a community with your family around you is far safer than what we're currently doing to people who we consider high risk, who we take away from their family in this community 6 weeks prior to their birth and put them in a place that's often culturally unsafe and leave them there for 6 weeks, have their baby, then throw them in a bus and send them home. And that's meant to be reducing the risk of maternal and baby death rates. But in fact, what we've heard is that that's the sign to say, hey, come in and take the kids because we've left the family without the mother. That's the time that we have to think about what are we doing in healthcare that unfortunately opens up avenues for, other services to jump in and disarm families. So I think, yes, we're trying to say, hey, there's a way of doing this, and we used to know how to do this, and we still know how to do this. And in fact, guess what? Our parenting and family development programs are really critical. We should be running them.
Yeah.
Let us do them and learn from them rather
absolutely.
than create the deficit around them.
Absolutely. Thank you so much for those comments. I want to just move now along to Kelvin because, again, just making reference to Janine's talk, there was a real focus on revolution, not necessarily a reset. And I think that in terms of the field of practice that you're in, the kinds of innovations and technologies that are coming online, both in medicine, in new techniques, in diagnosis, in treatment, in using tools and resources in different kinds of way, Kelvin, that's something that can be really well expressed in your field of practice. How do you think we can use innovation and technologies to innovate and to reset the Aboriginal health agenda in a powerful way?
I think it's really important to acknowledge leadership in this role, and I think one of the things that you're raising there is the medical teams and having empowerment from the community involved in those medical teams, no matter whether you're a midwife, a carer, or the doctor in that situation is very important. But I think it's one of the things I wanted to raise today, and I've kind of changed a little bit in what we're thinking about, is one of my frustrations in the conversation is that the people who are setting the policy, the people who are setting the systems, just don't get it. And I think and that's not in a nasty way at all, it's just in a way of understanding, and it's probably mid-afternoon, so it's a nice time to do this little experiment, which is fun. I do with medical students. If all the guys stand up, all the girls sit down, all the guys stand up for me, all the guys stand up. And this is an illustration of how we think. And so of all the guys standing up there at the moment, you can sit down, only if certain things happen. If you get up in the morning, you're getting ready for work, you sit there and you think what outfit you're going to wear, you think about where you're going to work, you think about the environment you're in, and at the end of that time of shaving, washing, all those kind of things, if you shower, you look in the mirror at the end of it and say, you know what, I look good. Stay standing if you say that. Sit down if you don't say that, and think about those things. Sit down, honestly. At the end of that morning, that you don't think about all those things. There's a few there. Now let's reverse that. All the girls stand up, all the ladies stand up. And this is purely about context, and this is away from an Aboriginal sphere. So you can stay standing if you're a female and you get ready in the morning and you think what you're going to wear. You make sure your shoes match your bag. You put your makeup on. You think, I look all right. Then you think about the other things that we wouldn't necessarily think about. Am I working in an environment where I'm with a sexist pig today? Is my blouse a bit plunging? Do I need to wear a scarf? Am I wearing a skirt? Am I going to be on stage in front of everyone? Should I wear pants today in this forum? Am I going to park near work? Am I finishing work at 8 p.m? How am I going to get to my car safely? Can I go out with the girls tonight, walk through a park and get home? Sit down if you don't think about any of those things at all. You don't think about those things at all. And you look at that difference in looking at that, in thinking about the context in which we behave, is really stuff we don't even think about. Yeah. Yet every guy in this room, he would go, I know what sexism is. Yet they don't live it, they don't understand it. You can all sit back down. and it's a nice little way to try and understand. I use this with my registrars and students all the time because it's a nice way to actually put your mind frame and your mindset and reset the way you think about things. So that if it means that you have to think about these things, then that means the way that we do our daily business is wrong. We need to change that sexism in the workplace. We need to change harassment and bullying that's going on so you don't feel like that you can wear whatever you want, that you can go for a drink on Friday night and go home however you want to go home and not even think about what you're wearing or where you're going or how you're going to get home and all those kind of things. And that reset and that refresh in the way you think about things is what's needed. Because all of the points made today and all the conversations had today are phenomenal and they're really exciting to have. But unless you're in the right frame of mind to understand that, it makes no difference because you're trying to do something for someone else. And I really think the challenge for us is how do we get the people who don't get it to understand what we're talking about when we talk about all these things.
I think it deserves a little round of applause. That is certainly front of mind, and I was thinking that we might talk about technological advancements, but actually it's just a mindset shift, and that would actually be an innovation in the workplace that allows for both men and women to participate equally. It'd be great to get equal pay for what we do. That would be a really good shift. If anyone can change that, that would be awesome. And then just to be able to reset our minds and our hearts, really, and have empathetic engagement with not only each other, but the people who come in through the doors who require us to be trustworthy and to have that empathy and compassion for whatever experience that we have. Kelvin, thank you. Very good comments to make. I'm wondering now if I can move right along to Darryl, who has been a leader in the Aboriginal community-controlled health sector for such a long time, who has been contemplating these sorts of issues for at least a couple of decades in the role that he's currently got. How would you really want to reset this agenda? Is it something that you can do with the area in which you're working? Yeah, one button there. That's it. It is right now.
Can you hear that?
Yeah.
First, I want to acknowledge Aboriginal owners, the Eora people, and I think that's the important thing we have to say every day today with all our kids, and we talk about that all the time. So it's so important because we want to change the concept of it and make our kids understand that they need to move forward with that cultural issues because that's our everyday. I want to also acknowledge some of the CEOs here from medical services. And I know with you how difficult it is. So I want to give you that support. But I also believe what Dr. Kelvin Kong was talking about is that you look at yourself in the mirror every day and you want to adjust things in what you've got on. And when you're doing that, you're adjusting things, you're thinking, wow, what's ready for me today? I want to make myself as an Aboriginal man that people are watching me, how I walk, how I talk. And I don't do drop paper. And I know people are stigmatising me, and then I have to be there for my community, the Darryl people. It's so important to me. Plus I come along with a lot of other things that from my grandparents, who were very strong people. And grandmother, as a stolen generation, thought that I will never let it happen to her community. When, again, after coming out of slavery, back to the mission, married my grandfather, getting 30 to 40 kids. But the little things they taught us, never use the word I, because you're not including the other people. Never think of yourself, because you're not better than anyone else. And my grandmother said, if you do the right thing and get the mum on side and clear the mum's head, the family's on track. So it's all those little things that we need to think about first before other things. And so I learned something when I was with the police in terms of negotiating with Aboriginal people. You know, and the police is probably the hardest job I've ever done. But becoming a good negotiator and understanding the important things that elders bring to us that we send them to put on the bookshelf and pick them out in the community and say, and understand the community before you come there. And look at the socio-economics and say the housing, employment and all the other stuff. With the whole community, very low, But then with your community, it's probably 3 times as worse. So understanding all those things and picking up the leaders within your community, take them out of the underneath the factionism within your own community and make them strong. And they, the elders, will give you the strength to move on and build people confidence. Look at the health. It's so important. It's building those strengths. I have to look at myself and say, am I strong enough to do that? Build yourself first and then work on your community. And get them coming with you. If you give them the opportunity to have their say. Because they want to do the right thing. And I think that's the greatest thing that's happened in our community. And I don't take any responsibility for that. But with a beautiful community, beautiful board, but discussion and communication on a daily basis. And now our elders are like butterflies. They fly in, laugh, joke, and fly out. And the strength we give to the women, because they need that, will come out of domestic violence, come to work with busted eyes, busted lips. And to see today the young ladies, my 7 young ladies, managers, it's a great thing. And then bringing all your community along with it, and as a team. And the extended, we talk about extended families. We all know about that. Well, how do we do that? With other people. Through MOUs. With great people like Area Health, PHN, TAFE, drug and alcohols, and all those sort of things. But we control that. And if they don't do the right thing, we break this. It's being honest, sitting up and talking about it. And I'll give you an example. One of the major organisations a couple of years ago came in, with all this money, and they said they want to do this and do all that. Give us some money to employ some Aboriginal people. I didn't see them for 2 years. But they come back and they wanted us to sign the review for the government to get more money. And I brought my PA in, I said, take a note of what they said. Started talking, got to the point where they want to sign something. I said, I'm not signing anything. I said, why? What did you do for us? You didn't do what you were saying you're going to do. And you got to be honest. Get out. Don't excuse me, get out, please. But you've been honest about things. Honest with the board, honest with the community, and honest with yourself. I think that's the greatest thing that God can give you.
Kamer, thank you very much. So that real investment in creating safe spaces for elders to come and be there with us, journeying together, to share the load, to take that leadership role, to bring that cultural integrity into our spaces, and to hold people to account to that level of integrity is something that I just took away from those conversations there. So thank you so much for that. And one of the things that you talked about as a really important mechanism for helping to reset the agenda were those formal processes of MOUs and partnership agreements and putting things in place so that you can actually come back and have a good communication and a strong relationship with each other through those sorts of mechanisms. It gives you something to keep coming back to and really interrogating. And it sounds like you've got good relationships there between yourselves and the local health districts. So let's come along to both Amanda and to Nathan now. And Amanda, you take incredible stewardship over a vast number of people and deploy them to do good health activities. So in your experiences, how do you feel you're faring in terms of Aboriginal health and the Aboriginal health agenda? And how are you going about helping to reset the agenda so that the kind of aspirations that have been discussed today are able to be really heard and to be fulfilled?
So can I also acknowledge the traditional owners of the land that we meet on today, and elders past and present, and my dear colleague Darryl, in terms of the partnership that we have about delivering, Aboriginal, culturally sensitive Aboriginal health services out in South West, and also my colleague at the end of the seat there. I think there are a number of things for health that we need to be aware of. Health, I think, has got multiple agendas, but in terms of Aboriginal health, it's got an internal agenda around its own people. So there are more than 12,000 people who work in southwestern Sydney, and when we were established as a district, one of the real priorities was to think about how did our organisation actually see our Aboriginal, our Indigenous community. And so we spent a lot of time around the cultural awareness, and it's not the end goal, please don't think it is, but it was actually trying to really reset our thinking and our understanding about history and culture. And unless we actually start there with our own people, the people who deliver services every day to this very big community, I mean, South Western has over 960,000, nearly 1 million people, we're not going to have things in the right place to start with. So we did a lot of work around the material that was put out by the ministry. We did the online, but we did the face-to-face, and our rates now are up around something like, 75 to 80%. And the value of that is not only internally around resetting people's understanding about Aboriginal history and culture, but it's the ripple effect that they take to their families, to their friends, to the conversations that they have around that. So that's what that was about. And by no means, as I said, was it the goal, but that's where we did a lot of work. And obviously we've got to build on that, because some people, very clearly understood, some people didn't. And is there still a large amount of racism? Yes, there is, but it's chipping away and working on that. So we've done a lot of work internally to really reset that. And then in terms of externally, and thinking about, my role in that, there are two really key roles that I have, and that's around the leadership and the structures and the processes that we've put in place internally to really send a very clear message to the people of the South West, and obviously at a statewide level, that our commitment to Indigenous health is absolutely at the centre of our business. And the conversation that we had with Elizabeth was about saying the reset button is not about saying that Indigenous health, you do all of this and then you do Indigenous health, is at the centre of our decision making. There are 16,000 people who live in the Southwest whose, where Close the Gap has got so far to go. So it's got to be at the centre of our decision making. So my leadership is about how I work with Nathan to set up structures and processes that absolutely embed the needs of our Indigenous community at the centre of our business and what we do. So that's the first thing, and I'll let Nathan talk a bit more about that. But I think the other really important one is around partnership. And I get concerned because it probably relates a little bit to what Darryl said, that collaboration, partnership, they are such throwaway words. You hear them and you hear them and you hear them, and we sign an MOU and whatever. But where is the concrete deliverables? Where are the concrete changes that have occurred because of those partnerships? And to me, that's what I'm looking for. So when the district was started, we had a large group of our little babies and our children who really needed ENT services, funny enough. And we just couldn't sort out to get them in. And then with Darryl, we set up a partnership. We were able to identify the children. We set up specific clinics and theatre sessions to get them through. And I think now the wait list is, I don't know, it's hardly, there's hardly any not very many kids on that anymore. That's a demonstrable change in access to services and the health status of those kids, which is not just about getting the operation, but how their health then influences their learning, their own self-esteem, and all the things that go with it. And so that's what partnership is about. That's what delivering on partnership is. That's what true collaboration is about, when we can work and do that but for the AMS to say, these are the things that we need you to do, how can we do them together? Not me saying, well, I think we should do this, because that's not how it works.
Thank you. And Nathan, have you got some practical examples of that? Yes, thank you.
Yeah, look, I guess I'd talk about a few things around, and it is a journey that we're still on in terms of how we've built a governance structure in southwest Sydney that's made Aboriginal health a priority for the organisation. And it hasn't been without its challenges, but we have made some progress, and Amanda's touched on a few of those things. Look, I guess some really key things for us, it's been a bit about how you elevate the Aboriginal voice within the organisation. And making sure that that's happening at all levels. And Amanda did some really practical things at the start in terms of where the Aboriginal health units sat within the organisation. So in other LHDs, Aboriginal health can sit anywhere in terms of, reporting to directors of populational health or other directors within the health service. Southwest Sydney took a decision that it reports directly to the CE. That sends a message immediately to the organisation, to the staff about it's a priority. So those practical things have been really, really key. But we've done a lot around our structures, like I said, around making sure that Aboriginal voice, both from within, and when from within I talk about our workforce and our Aboriginal health staff, and then our communities and our community partner organisations, and we've had a lot of focus on building those relationships. I want to use a little quote from a very learned colleague that I've got, who often challenges the way that we think around our structure and our engagement and the work that we do generally in Aboriginal health. And I guess her name's Anya Hillis-Munro, and she talks about moving beyond being beholden to the goodwill of non-Aboriginal people, and developing structures and systems that truly engage Aboriginal people and put us in the forefront of decision making. I guess that's kind of been our mantra and driven the work that we've done in southwest Sydney around our governance structure. And there's been a couple of key steps to that. So, we started from a reasonably low base. I've been there 6 years and there are a number of challenges. We had a very disempowered workforce. We had long-standing vacancies in terms of our Aboriginal health workers, all sorts of things. So the starting point for me was really around how you empower that workforce and how you engage with those Aboriginal health workers. To me, they're still the centre of our model, and it's so important that we pay due respect and acknowledgement to the important role of Aboriginal health workers. Working in a local health district, I've seen lots of examples of over time of how far we've gotten away from that, and that due respect around how important they are isn't paid, and that often they've ended up becoming the junior partners in relationships with clinicians, and that was never the intent of the model. It was always about a true partnership, bringing that cultural and community skills sitting alongside those clinical skill set to better meet the needs of the patient. So that's been a real challenge for us. That work in terms of re-engaging with our workforce, thinking about our service models and re-empowering our Aboriginal health workers has been really, really critical. I guess then the other bit has been around our partnerships and the way that we engage with our Aboriginal community organisations. So in southwest Sydney we've got 3 key community organisations that we've got formal agreements with. Fortunate enough here to have Darryl with us, and there's fantastic work that Darryl Aboriginal Medical Service does in terms of meeting the needs of our communities. But really what we took a new focus in terms of how do we engage with these organisations and have an equitable partnership, and I guess try and manage that power imbalance. When you look at our health outcomes and health statistics, and you think about the responsibility that the New South Wales health system has to meeting the needs of Aboriginal people, we need to be going to these guys and engaging with them and using their skills and knowledge to inform how we do our business. And we need to shift that dynamic in terms of, this junior partnership, but having our Aboriginal partner organisations there at the same level as us, engaging in a meaningful dialogue, informing our service models and how we do our service provision. I guess that's the approach we've really taken in southwest Sydney, is to sit down with our partners individually, understand their experience, hear their feedback about the challenges in terms of access for our communities, what's worked and what hasn't, and I guess start really unpacking that and look at our service models. Amanda gave a really nice practical example there. with the ENT surgery pathway that we've got, where we've really turned the system on the head. So, rather than just having our kids sitting on the public waiting list, we've prioritised the needs of those kids. We've developed a specific pathway, and the outcomes have been fantastic.
Can I ask a question then? Because we were talking before about the importance of data, and we're going to have another presentation back on that afterwards. Have you had that written up, that redefining the re-evaluation and the renegotiation of a different pathway into ENT service delivery? So that it actually hits the peer-reviewed publications in any way?
Not the ENT pathway, no.
Okay.
Sorry.
So again, I mean, you have to come to these sorts of forums to find out about these amazing things. And what all of you have talked about enormously is a really strong investment in a trust economy. That's what it seems to be like. You're actually investing in trust, not in a transactional way, but in a way which actually mediates a process of negotiation so that you've got shared investments in the outcomes that happens, and the outcomes are determined by the quality of the processes that you're engaging with. So I'm just going to ask all of the panellists then to make a bit of a commentary for us. The two things. The first is about this trust building between organisations or from within your own positions. How can we use this reset agenda to help build trust and participate in that trust economy? The second thing is that all of us have spoken about our engagement with the health service delivery service sector. What does it actually mean to live a good quality life as an Aboriginal or Torres Strait Islander person? What does that actually look like? What does that feel like? Are we waking up, contemplating, getting dressed in the morning and then having to steel ourselves to walk out the door because the very first time that you're in public in the day is getting onto a bus and you experience discrimination there? And that's the first thing that you've got to buffer yourself against. And I'm thinking about the empowered communities process, which has in some ways said that, all children joyfully go to school. And so that's implicit. There is something really joyful about a schooling experience. But what does that actually mean for you as the panellists? The trust economy, and what does it mean to live a good life? I'll open it up to the panel. Perhaps, Janine, because your throat's probably back online now.
Can you hear me? Yeah. Probably in terms of what does it mean to have a good life. So life is from birth to death. So I actually believe that we can have a good death too. So there's lots of work being done at the moment in palliative care. But I think any day that's a good day is one without resistance. When we can walk seemingly through a shopping centre and not be asked for your receipt as you walk out of Woolies, even though you're in your most expensive Lorna Jane's. And they check it, and so, all of those little microaggressions is what I'm talking about. And the tyranny of low expectations too. That, the other day I just heard some statistics on NAPLAN, which is that our kids go to school with really high expectations for themselves. And we see that in the first NAPLAN results that come out. But by the second NAPLAN, not only the kids' expectations lower, but it actually matches the expectation of their teacher. So, that tyranny of low expectations, that the best is expected of us, and that we have, a less resistant move through life. And what was the other one?
The economy of trust.
Oh, trust. Okay. When I was smiling sitting up here before when you were talking about trust, because one of the things that we talk about at Cats and M when we get into a relationship with another organisation, we take some, knowledge from the STIs and BBVs, which is be careful who you get into bed with and use protection. So, and that we build, we do trust over time. So, and we do reciprocity over time. So at the moment we've got a project up and running, and it's called the Leaders of Indigenous Nursing and Midwifery Education Network. Within that, we haven't asked any of the universities to actually give us any money to be members of that particular network. We've asked them to give their time and to give their buildings and those sorts of things. So it's not this, usual exchange that's what's expected of us, which is money, but it's bringing it back to Aboriginal ways of knowing, being and doing. So that trust is based on that as well.
Uncle?
I think one of the greatest things is our community, see them smile and walk around with their heads up and communicate, talk about the problems, and then have an open door policy where they can come and sit down and have a laugh.
I love that. Policy statements. Every person who comes in through this door needs to be able to have a space to sit down and have a laugh, feel good about themselves before they go. Wouldn't that be awesome? Thank you. Juanita, how about for you?
Well, trust, I think, is critical to good partnerships. And I think that there's more to partnership building than just within the health sector. I'd love to see us extend into more intersectorial approaches so that we're working side by side education and we're working side by side like we used to. We actually live and breathe the way we view health, and that it is holistic, and that we actually are supported to work in that space rather than working in our silos. So I'd love to be able to be promoting that space.
Amanda, for you, what does it mean for a person to live a good life, and what does it look like to have that trust economy?
Just a little story. Darryl and I were over at, and Nathan, I think you were there, we were at Warren, which is the childcare centre, and the kids from, I think it was Miller, was it the Miller school came over?
Eds.
Sorry?
Eds.
From Eds came over, and we came over, of course the minister was coming to make an announcement about something. If you saw the look of happiness, excitement, you know, absolute glee on these kids' faces, it was, you couldn't bottle it or buy it. And so for me, seeing the first 1,000 days of life, that first 5 years of life is the most critical time. And having those children with confidence and resilience and feeling really good about themselves, to me, is I think is just, you know, the most valuable thing ever. It really was, and that's what we saw that day with those children.
Beautiful. For you, Kelvin?
There are two components to thinking about that. The first is the trust economy is something that is bestowed upon us and responsible of us to ensure that we set the systems up so it doesn't fail our kids. And in those systems, we need to make sure we break down the institutionalised racism that exists in corporations. I think for organisations, as individuals, we can easily talk about racism, but as organisations, we're just really terrible at actually discussing it and how do we actually build systems in to stop that. And it's quite difficult to do. I don't think it's an easy task. I think it's something that we have to do. In terms of you know, what I see in looking at a future when I see the kids is same thing as Darryl, is just the smiling, the laughter and the confidence. You know, I was looking after this one little kid, 9-year-old from up Kempsey Way, and he came down for an appointment in the rooms and he was understanding of the health system. He was confident in walking around the hospital, and he was so confident that he brought 10 of his family down because he knew how busy I was and he didn't want to upset me, so he just brought them all down so I could see them all at the same time. And, you know, this isn't a half-hour slot, so he brought the whole mob down, but on reflection, looking at it, you know, the confidence he had to actually say, you come down, here's my mate, I'll get you looked after. The confidence he had in walking around the hospital with his family being proud, and that's pretty hard to do in some of our environments. And also the confidence to engage and have this conversation with a big smile on his face, knowing he was being cheeky, was really rewarding in many facets, because it meant he had a good journey through the health system, it meant he had a successful journey through the health system, and meant he had some confidence about him as an 8-year-old kid, where they're starting to get some of that, well, I shouldn't say starting, they've already started seeing a lot more of the racial overtones that we have in society, and to have all that all kind of expressed in that short session was really nice. So I think that'd be a big thing for me.
Nathan, how about for you? Trust economy, or what does it mean to live a good life?
Trust economy, I guess, from my perspective, particularly talking from someone that works for a government agency, guess it's about taking that time to understand the context that you work in, and that's about building the relationships with the Aboriginal organisations, understanding the communities that you provide service to and the history of those communities, and making sure that you've got that baseline knowledge to inform your engagement. Then I guess the other really key component is around that mutual responsibility, and being clear about what each partner brings to an arrangement, and how you monitor and live up to those commitments, I think, are the key things. And then I guess in terms of a healthy life, I guess the way I think about that is when I think about my kids and what I want from them. That's a nice, simple way for me to do it. I guess, I want them to feel connected to their culture. I want them to feel proud of who they are and their identity. I want them to have equal opportunities, and I don't want them to be impacted upon by racism or the stereotypes or the unconscious bias that, so many of us have had to experience.
Thank you so much, panellists. That was such a wonderful part of the conversation, and now we're going to hand it back over to you. Again, another 5-minute slam session to get those little post-it notes out there so that we can get a visual representation. We'll hear back from some of you before 3 o'clock. But that idea then about what does it mean to live a good life, and how can we reset this Aboriginal health agenda so that we're building trust and we're building confidence in ourselves and how we actually walk in the world, not just for us, but also for our kids. Can you also join me now in thanking the panellists before they leave the stage?